Dr. Bob, or God Bob, Bob Grossman, again, I'm an innovator of these. I've begged him to write a book. I may just do it for him. I've told him before, I said, can I just do it? He writes very dry. If you want to go to sleep, it's great stuff. But if you're really into it, get in a field with him. Get a job with him. Do something. For horizontal abduction, another one for posterior cuff guys, you try and reach your arm across the body, and it's like, that's it. Find the edge. Knees are bent. Make them roll. Get more. Make them roll back. Okay. We don't do this one a lot because guys mostly have it, but you can definitely do this, and I've also created another way. So this is using that same rolling. I've done it in a way where we use, so this is us doing it. This is the steps. We just go to that. I like this. 90-90. Okay? Hips extend, way up. I get slack, I push harder, she drops down. That's the stretch. We'll go through those variations. Functional internal rotation, this is one for a lot of patients. You don't have to be a shoulder pain thrower to be, that's all I got. Same idea, this is in sitting. Reach as high as I can. She takes me to a barrier of motion. I flex forward, I get a lot more. That's actually the cheat. I got so much of that. No way. And then I extend my back. She holds that tight. When you are the closed chain, when you as a therapist are the closed chain, you gotta be like, get comfy and watch that arm. Don't let it move, because if you even go a little bit, you're eliminating the whole point of the setup. This is just a little external rotation sideline thing. Wilk and all these guys have studied this EMG-wise. It's a great way to strengthen some of these things. Good proprio, good. I love the hands-on. Anytime we can do hands-on exercises versus like give them a band, send them into a corner with a list of exercises, I'd rather do the hands-on. Here we can. I know in some places you can't do it. Demand that, or go somewhere else. Find another place to work and help people. Closed chain manipulation for external rotation. Okay, bend your knees. Raise your, so I'm going to externally rotate, see how far I can go. Okay. Raise your hips as high as you can. Okay. That wasn't me doing anything extra. Okay. I give it, so I can't go any more. And then you slowly lower the hips until you feel that kind of come on. And that's it. And then she's going to hold 20 seconds or so. Raise the hips up. Always end by redoing the order. And then bring it all back down. Go. Okay. Lie on your left. Such external rotation with 90-90. It's powerful, and I don't do anything. I'm just making sure this doesn't move. This is the important part. Back up a little. Okay. A lot of times we'll go over top of them, grab, and sit that back. So she's on it now. If she starts to come forward, then it's a Hawkins Kennedy, and you're going to hurt everyone. Okay. Find the. Now, so here's the thing. Watch this. If I can roll her backward by doing this. So that gives you an idea about this myofascial winding, right? Hold it, you roll back, don't get off your arm, just roll backwards. I get a little more, okay? That's where I want her to stop, and that's where I want her to finish. So go ahead and roll forward until you feel that pull again.
And then with your right hand, you just block it.
Yeah, so she doesn't, exactly. This is also more comforting when the person feels like you got them. If you just use that arm, they're like, I ain't going anywhere, it's gonna hurt. You okay? Mm-hmm. And then roll back, and then I come out. And you can measure things in sleeper stretch position too if you want. It's fine. On your back again. Knees stay bent. Let's say you're missing horizontal abduction, or you just worked on some external rotator cuff tissue, whatever. Relax. I'm going to push her across. She's got a lot of it, so I'm not worried about it. But let's say she didn't have a lot. Roll your legs, keep your feet and knees together, roll your legs to the right. I'll get more. I'll lean on it, and then you're going to come over this way. And I'm just watching here. And when you, and I'm preventing this from sliding up the left shoulder. And she's going to roll to the left as far as she can until she feels that pull. She may even feel some. There, I felt it. What do you feel? Sure. You feel it because the arm wants to go back where it came from when you've wound it up. Okay, roll back to the middle, and then relax.